All right, diving deep today, we're tackling pyelonephritis,
Ooh.
which a lot of people think is just like a bad UTI.
Yeah, it's way more than that, though.
It is. So we're talking kidneys.
We are. It's when that infection actually spreads to the kidneys, one or both.
And most people don't realize it often starts with like
Mm.
a pretty normal bladder infection, right?
Absolutely. Usually that E. coli
Oh,
bacteria.
yeah, that E. coli always seems to be around.
It is. It's one of the most common culprits.
So it starts there in the bladder and then
And then think of it like it's taking a trip, right? It travels up those tubes, the ureters.
nice little highways.
Yeah, straight to the kidneys.
Not good. So who's more likely to be in this situation?
Well, if you get UTIs a lot, that's a big one.
Makes sense. Gives
Yeah.
those bacteria more chances, I
Well,
guess.
exactly. More opportunities to make that journey, unfortunately.
Oh, so it's like you're wearing down your defenses.
You are. And anything that compromises your immune system, like diabetes,
Oh, yeah, I was going to ask you about that.
that's another big risk factor. Makes it harder to fight off those infections.
So it's almost like an open invitation for the bacteria.
It really is. The defenses are down, and those bacteria take advantage.
Now, what about kidney stones? Do they play a role in this?
Oh, absolutely. Think of it like this. You've got a stone, like a dam in a river,
Ooh, I like that analogy.
right? Blocking the flow, and that creates a perfect little spot for bacteria to hang out and multiply.
So the stone is like a trap for the bacteria.
Yeah, and it just makes that infection worse.
Makes sense. Now, catheters and urinary surgery, those must be risk factors too, right?
They are. A catheter can be a direct route for bacteria to get in, bypasses all those natural defenses.
It's like a shortcut for the bacteria.
Exactly. And after surgery, you're more vulnerable while you're healing.
So it's all about those opportunities for infection, really.
It is.
So we know how the bacteria get there, but how do we know it's more than a UTI?
Well, one thing is the pain. UTIs, you usually think lower back pain.
Right.
But with pyelonephritis, it can be higher up the back, radiating around the sides.
Oh, interesting. So it's not the typical lower back pain.
Nope. And along with that, you might get high fever, chills, even nausea and vomiting.
Ooh, that sounds awful.
Yeah, it's like your whole body's saying something's wrong.
Definitely not something you want to wait out then.
No. Those symptoms, especially that high fever with chills, you need to see a doctor right away.
So we're talking about a serious situation here. You mentioned complications earlier.
I did. Things like kidney abscesses and even sepsis.
Sepsis, that's really serious, right?
It is. It's your body's extreme response to infection.
Scary stuff. So how do doctors actually diagnose this?
Well, they'll ask about your symptoms, do a physical exam.
Pretty standard so far.
Right. But the key is the lab tests. They'll look at your urine for bacteria, white blood cells, that kind of thing.
Those are all signs of infection.
Exactly. And they might do a blood test too, looking for those infection markers.
So it's really about those telltale signs of infection in the blood and urine.
It is. And they might use imaging tests too, like ultrasound or CT scan.
Are those always necessary?
Not always, but sometimes they can help rule out other problems.
Like those kidney stones we talked about.
Exactly. Or any other structural issues.
So it's about getting a clear picture of what's going on.
Yep. Putting all the pieces together.
Okay, so let's say it's pyelonephritis. What happens next?
Well, antibiotics are the main treatment, but how they're given depends on how bad the infection is.
So for milder cases?
You might just get oral antibiotics. You can take those at home.
Okay, that sounds manageable. What about the more serious cases?
Those usually need intravenous antibiotics, which means a hospital stay.
So it really depends on the severity,
It does. And no matter what, you got to finish the whole course of antibiotics.
even if you start feeling better, right?
Especially if you start feeling better. Otherwise, you risk those bacteria coming back even stronger.
And no one wants that.
Nobody. And sometimes we have to address the underlying cause, too.
Like if it's related to a kidney stone.
Exactly. Or if someone has diabetes that's not well managed.
So it's about getting to the root of the problem.
It is, not just treating the symptoms.
Okay, so now let's talk about prevention.
Yeah.
What can people do to avoid this whole mess?
Well, one of the best things you can do is drink plenty of water.
I knew you were going to say that. But why is it so important?
Think of it like flushing out your system.
Okay, like rinsing away the bacteria.
Exactly. Keeps them from building up and causing problems.
So staying hydrated is key. What else?
Don't hold it in. Empty your bladder
Oh,
regularly.
yeah, we're all guilty of that sometimes.
No, right? But holding it just gives those bacteria more time to multiply.
Good point. Anything else we should keep in mind?
Good hygiene is important, especially for women, wiping front to back.
Right, to avoid spreading bacteria.
Yep. And if you get a UTI, don't ignore it. Treat it right away.
To prevent it from escalating.
Exactly, catch it early.
So prevention is all about being proactive.
It is. Taking those steps to protect your urinary health.
All right, well, we've covered a lot of ground here.
We have causes, symptoms, treatment, even prevention.
It's been a fascinating dive so far.
It has.
But before we move on to some real-life cases, I have one more question.
Okay, shoot.
Is there, like, a surprising fact about pyelonephritis that most people don't know?
Let me see. Well, this might surprise you, but women are actually way more likely to get it than men.
Oh, really? Why is that?
It's thought to be because of anatomy. Women have a shorter urethra, so bacteria have a shorter distance to travel to the bladder.
Oh, that makes sense. So ladies got to be extra careful.
Absolutely. Knowledge is power.
It is. Well, on that note, let's delve into those real-life cases and see how this all plays out in different scenarios.
Sounds good. I'm ready.
Stay tuned.
Okay, so let's jump into some real-life stories, kind of bring this all to life.
Yeah, I love hearing these cases. You really see how different it can be for everyone.
You do. It really highlights all the nuances we've been talking about. So first case, this really shows how fast things can go south. We've got a 35-year-old woman, starts with those classic UTI symptoms.
Okay, so frequent urination, burning.
The whole 9 yards, yep. But she kind of just brushed it off.
Figured it would go away on its own.
Exactly. And this is where it gets tricky. Within a day, things changed drastically.
Oh, not good.
No. High fever, chills, like couldn't stop shivering, and this pain in her side radiating to her back.
Yikes. Did she go to the doctor?
Thankfully, yes. By that point, it was pretty clear something was seriously wrong.
So, sounds like the infection was spreading.
It was. Doctors suspected pyelonephritis right away, urine tests confirmed it, and they did a CT scan too.
What could that show?
A small kidney stone partially blocking her ureter.
So that's what was causing the backup, giving those bacteria a chance to really take hold.
Exactly. Really shows how a UTI can escalate, especially if there's something else going on, like a kidney stone in this case.
Okay, so that's a good example of how quickly things can change. What about someone with a pre-existing condition?
Good point. Let's look at this 60-year-old man. He had diabetes, wasn't managing it too well.
And we know that can weaken the immune system.
It does, makes infections more likely. And his symptoms, they were mild at first.
Easy to overlook, I guess.
Yeah, just a little more urination, some burning.
Thought it was nothing serious.
Right. But a few days later, bam, high fever, chills, back pain. By the time he went to the doctor,
It was already bad.
it was full-blown pyelonephritis, needed to be hospitalized, IV antibiotics.
Wow, so it really shows that folks with weaker immune systems got to be super careful.
Absolutely. Even those mild symptoms, can't ignore them.
Okay, so what about someone who knows they have pyelonephritis? Like, what if they don't follow the doctor's orders?
Ooh, good question. We had this 30-year-old woman, classic symptoms, fever, chills, back pain.
So she went to the doctor.
She did. Got antibiotics, 10-day course, and started feeling better pretty quickly. Yeah, but here's the thing. She felt so much better, she stopped taking the antibiotics after like 5 days.
Oh, no. Thought she was in the clear,
Exactly. Figured she'd beat it.
but I'm guessing that didn't go so well.
Nope. Symptoms came back full force a week later.
Oh, man, that's rough.
It was. And the infection was even worse. Needed stronger antibiotics, longer recovery time.
So that's why you got to finish those antibiotics even if you feel better.
You do. Otherwise, those bacteria, they can hang around and come back with a vengeance.
Not good. Okay, so we've talked about ignoring symptoms, not finishing meds. What about something like hygiene?
Yes. Important one, especially for women. We had this 40-year-old woman. She had a history of UTIs.
So she was already prone to them.
She was, but she admitted she wasn't always great with hygiene.
Like what kind of things?
Wiping back to front, using douches.
Yeah, I can see how those could cause problems.
They do. Introduce bacteria, disrupt the natural balance.
And that's exactly what happened to her, right?
It is. Developed pyelonephritis, probably from a UTI that wasn't treated quickly enough, and those hygiene habits definitely didn't help.
So it really emphasizes that those little things, they matter.
They do. Prevention is key. But let's shift gears a bit now. We've been focusing on physical stuff, but what about the mental side of things?
Oh, interesting. Like the mind-body connection.
Exactly. We know that stress, anxiety, those can weaken the immune system over time.
That makes sense. When you're stressed, your body's not focused on fighting off bugs.
Right, releases hormones like cortisol, which can suppress the immune response.
So basically, stress makes you more vulnerable to infections.
It does,
Mhm.
including UTIs, which we know can lead to pyelonephritis.
So it's not just physical health, it's mental and emotional well-being too.
It's all connected. Things like lack of sleep, bad diet, not enough exercise, those can also weaken your defenses.
Wow, so really a holistic approach to health is important.
Absolutely. Okay, now before we move on, one last thing to ponder. We've talked about water, emptying your bladder. But I'm curious, what are some things we do every day, maybe without even realizing it, that could be increasing our risk of UTIs and, in turn, pyelonephritis? Something to think about as we wrap things up.
That mind-body connection, huh?
Yeah.
It's wild how much our mental state can affect our physical health.
It really is. Shows you got to think about the whole picture, not just one aspect.
Totally. And I've been thinking about those everyday habits we talked about, the ones that could be sneakily increasing our UTI risk.
Oh, yeah. What have you come up with?
Well, one thing that hit me is how often we put off going to the bathroom,
Oh, yeah, big time. We know we should go regularly, but
but life gets in the way.
it does. Busy, distracted, and then suddenly you've been holding it for way too long.
Exactly. And it's not always about being busy either. Sometimes it's just like not wanting to interrupt something.
Right. Like a movie or a good conversation.
Yeah, you think, I can hold it a little longer, but those little bits add up.
They do. And everyone's different, too. What's fine for one person might be pushing it for another.
So true. Got to listen to your body on that one.
For sure.
Another one for me, not drinking enough water. I know, we talked about it.
It's easy to forget, though.
It is. And sometimes you don't even realize you're dehydrated until it's too late.
Right. And when you're dehydrated, that urine gets more concentrated, perfect breeding ground for bacteria.
Yuck. And speaking of drinks, what we drink matters too, right?
Absolutely. Things like coffee, alcohol, they're diuretics.
Meaning they make you pee more.
Exactly. Can irritate the bladder, too?
So maybe swap that extra coffee for some water.
Good idea.
Okay, here's one that might surprise people.
Oh.
Clothes.
Oh, interesting.
Yeah, like tight clothes, especially underwear that's not breathable.
Ah, I see where you're going with this.
They can trap moisture, create that warm, damp environment that bacteria love.
Makes sense. Gotta let things breathe.
Right. And while we're on the topic of down there, hygiene products can be a culprit too.
Oh, yeah.
Like those scented soaps, bubble baths, anything that messes with the natural pH.
Disrupts that balance, makes you more prone to infections.
Exactly. Gentle and unscented is the way to go.
Definitely.
Oh, and here's one I bet a lot of people don't think about. Wiping too hard.
Wiping.
Yeah, after using the bathroom.
Yeah.
If you're too rough, it can irritate the skin around the urethra.
Makes you more vulnerable to infection.
Yep. Gentle is key.
It's all about finding that balance, isn't it? Clean, but not too harsh.
It really is. Crazy how these little things can have such a big impact.
It is. But the good news is we can control a lot of these things.
Exactly. Small changes, big difference.
For sure.
So, to everyone listening, think about your daily habits. Little tweaks can go a long way. Maybe switch to cotton underwear, be more mindful about wiping, or grab that extra glass of water.
Great advice. It's about taking care of yourself, being proactive.
Absolutely. Well, that wraps up our deep dive into pyelonephritis. We covered a lot, from causes and symptoms to treatment and prevention, even got into those sneaky everyday habits.
We did. It's been a great discussion.
It has. Hopefully everyone learns something new and feels empowered to take charge of their urinary health.
Knowledge is power, as they say.
It is. So stay curious, stay hydrated, and take care of those kidneys. Thanks for joining us.